Australian Rotary Health play a critical role in mental health research in Australia, absolutely critical. Without them, there are so many things that we wouldn't know. And if you think about my field in particular, nutritional psychiatry, just as an example, the work we do is so influential that now it's, just in the last couple of months, we've had major pieces published in Time magazine, in the Oprah magazine, everything from the New York Times to the cover of the Scientific American Mind, etc. This is research that's had a really substantial global impact. That wouldn't have happened without that investment from Australian Rotary Health. And that's similar across all sorts of research that happens in Australia. If it wasn't for the Rotarian support, it just simply wouldn't happen.
We can't emphasise enough how crucial this grant was at the stage of our research project. It's the different kinds of research funding that are available for research like this is, it's a landscape that's very complicated to navigate, and it can be very hard to secure funding. So for health research, for instance, another major government funder is the National Health and Medical Research Council, but the success rates for those grants are so low, often on the order of 8%, 11%, and that's when all of the funders, all the people who are applying for funding are doing great research and are competitive. And often the research that falls by the wayside is the stuff that is the most kind of on the edge of science. So not the safe stuff that is really confirmed. It's the stuff where people are taking risks and trying something new that finds it hardest to get funding, and especially that startup funding to get the initial evidence that something might be promising. And so for us, for this research project, we really wouldn't have been able to do this by any means without the support of Australian Rotary Health. So it has been really crucial for us and for this research.
This funding, particularly having received funding for 2 projects, has made an enormous difference. I am extremely grateful for the support. With my work, I value greatly applied or pragmatic research. So I work in a clinic, as I mentioned. I want the research I do to have a really real-world impact. And both the school program and the online program, the primary purposes of the research are A, to test out that they actually work and are effective and helpful, and then B, to make sure that they are disseminated as widely as possible to benefit young people and to prevent really full-blown eating disorders from developing. So I really appreciate that Rotary seems to be attracted to research that is really seeking to have a real-world impact, and this work would not have been possible without that funding. So again, extremely grateful.
I think, mental health remains one of the most prevalent yet burdensome problems faced by children and adolescents and families in Australia. And whilst we do have plenty of effective evidence-based interventions out there, sadly we're faced with a major problem in a gap to service provision, where we know that in Australia only about 2% of Australian families will receive effective evidence-based interventions for their mental health problems. So we need to do much more in terms of understanding how we can improve access to these interventions, but also improve outcomes for those that are only demonstrating a partial response to these current best treatments that we have. So there's, a long way to go in terms of improving our precision in terms of mental health interventions, and also actually having an adequate reach to the families across Australia who are needing it. So it's enormously beneficial to have programs and organisations such as Rotary who put so much investment into mental health research, and I think make an enormous difference to the children and the families in Australia who need it most.